our healthcare system in Africa, especially Ghana. So today we are going to narrow it down to 2 topics. So I'm gonna go straight to the point. And once again, this is your RN Advocate Kana, and this is for the patient. So today we want to talk about the right to know your diagnosis and the treatment, especially the medications prescribed. So when you go to a doctor and after seeing you and he starts writing prescriptions for you, it is your right to know what is wrong with me and why am I given this medication and the purpose. I know that in Africa, the doctors are slammed with patients. They do not have time. Time is in fact and indeed a luxury in Ghana when it comes to taking care of a patient. But it is necessary as you talk to your doctor. I do not think it's you need a whole hour of education, but it's just that before the doctor orders anything for you, especially in sense of medication, he just have to tell you, all right, you have UTI, which is urinary tract infection, you have malaria, you have this and that, and this is what I'm giving to you. I am giving you maybe UTI, I'm giving you these antibiotics, I'm giving you amoxicillin precisely. And you know, when you get to know this, that also helps because many people have allergies. They cannot read prescriptions given to you because it is meant for the pharmacist to read. You cannot read prescriptions because they are written in Latin and it's meant for the pharmacist to read and teach you. So, it is your right to know that yes, dog, what is wrong with me? Okay, in certain instances, they might not come up with diagnosis because they will order some medications, they will order some labs or some scans for you before they can actually come to the conclusion, to pinpoint this is what you got. But in the time of waiting, they might give you some medication whilst you go for this test. But it is very important to know why you are taking that medication. Because sometimes the infection, we do not know, but they give you empirical antibiotic. I don't want to go deep into technicalities, but they give you a broad spectrum antibiotic to cover until it is, specify what kind of bacteria you have, then they can continue. But other than that, it is very important, and I believe that this will help curtail a lot of medication mismanagement, because a lot of you are patients don't really know what you are taking. Some of you don't even know that you have allergies to them, and you go ahead and take them because you cannot ask the doctor. But in a very nice way, a very nice way, you should ask the doctor, what is wrong with me? And what are you writing? Then when you get a chance to go to the pharmacy outside, which I know pharmacy inside, you might not be able to have the chance to ask, but you are required to ask the pharmacist. He may actually educate you more on the medication. So today's topic is knowing your diagnosis and your orders. What is given to you to treat that diagnosis or your medication, your prescription, you have to know. And if you don't and you are in a doubt, ask somebody. Ask a pharmacist, a nice pharmacist. Because you need to know what you are putting in your body. Irrespective of everything, you know you first. You know yourself. You know your system. Some of you, in Africa, we do not have the luxury of, having electronic, medical histories that can be pulled. Maybe it's coming or it's there, but it's not in every hospital. So sometimes you might have allergies, you may not know, but probably they told you before and you know. So when you go and they prescribe anything and you know what you're taking, then of course it helps you too. So our patients, it's not being arrogant, but I think our Ghana system, no matter how bad it is, I think we can use 1 minute, 2 minutes to, as you are even writing the prescription, or even ask the patient getting ready to leave, you can actually, the doctor can talk to you and say, I'm diagnosing you with malaria because probably your malaria test is positive, and I'm giving you this medication to take. And I think it is your right to know what you are taking. Anyway, this is your Iron Advocate Kana. If you have a question, you have been treated not well, or a victim of our Ghana medical system or African medical system, drop a comment and we will look at that. And once again, this is not a channel to discriminate, judge any medical professionals, but it intends to help. Let's better our healthcare system. A whole lot of people are dying because of some little mistakes that have been overlooked. So, help me. Join me. Let's do this. And once again, knowledge is power. Without knowledge, my people perish. That's what my Bible tells me. And I also want to assure you, after you know all this, nothing is happening. We have a Savior. It's Jesus. He can still heal without medication. So, drop a comment, share this to people, and let's better our health system. Join me. Let's do something better in our motherland. Wherever you are in our beloved country or continent,